Here we'll learn innervation of the lumbosacral plexus, and innervation of the hip, pelvis, and thigh. Let's begin with the lumbosacral roots that supply the plexus. Specify that L1 alone supplies the iliohypogastric and ilioinguinal nerves. L1 and L2 supply the genitofemoral nerve. L2, L3 supplies the lateral cutaneous nerve of the thigh. L2 through L4 supply the obturator nerve and the femoral nerve. Key femoral nerve sensory branches are the intermediate and medial cutaneous nerves of the thigh and the saphenous nerve. L4 through S1 supply the superior gluteal nerve. L5 to S2 supply the inferior gluteal nerve. And L4 to S3 supplies the sciatic nerve. The key sciatic nerve branches that innervate the lower leg are the peroneal nerve or the fibular nerve and the tibial nerve. S1 through S3 supply the posterior cutaneous nerve of the thigh, a key sensory nerve on the back of the thigh, and S2 through S4 supply the pudendal nerve. Start with a differentiation of the upper versus lower plexus. Draw a lower spine, pelvis, and show a femur. Indicate that L1 through L4 forms the upper lumbar plexus. Then show that L4 through S3 forms the lower lumbosacral plexus. Now let's discuss the major nerves that innervate the hip, pelvis, and thigh. Redraw the lower spine, pelvis, and femur. Include the relevant lumbosacral nerve root foramen, and also include the inguinal ligament. Show that the femoral nerve supplied by L2 through L4 originates from the upper lumbar plexus. Draw iliacus and psoas major, which attach to the femur. Together they form the iliac psoas. Show that the femoral nerve ultimately passes deep to psoas major and anterior to iliacus. This is a key compression site in psoas muscle abscess or hematoma. Also show that it passes deep to the inguinal ligament, another potential entrapment site. The femoral nerve most notably innervates the quadriceps muscles, which provide knee extension, such as walking downstairs, and it also innervates iliac psoas, which provides hip flexion, such as climbing upstairs. The quadriceps muscles are rectus femoris and the vastus muscles, vastus medialis, vastus intermedius, and vastus lateralis. Iliac psoas comprises iliacus and psoas major and psoas minor. Note that the psoas muscles are innervated by direct branches from L1 to L3. Additionally, the femoral nerve also innervates sartorius, which is the longest muscle in the body. It spans from the anterior superior iliac spine to the medial knee. It functionally serves to decelerate the lower extremity during climbing movements. The femoral nerve also innervates pectineus, which lies in the femoral triangle. Show that the obturator nerve originates from the upper lumbar plexus from L2 to L4 and passes through the medial aspect of the pelvis through psoas major and then exits the pelvis through the obturator foramen to descend the medial aspect of the thigh. It most notably innervates the adductor muscles, which provide hip adduction, and also a variety of actions intrinsic to gait and stability. The adductors are adductor longus, adductor brevis, and adductor magnus. Note that adductor magnus is also supplied by the sciatic nerve, as we'll show later. The obturator nerve also provides some sensory coverage to the medial aspect of the thigh. The sciatic nerve forms from L4 to S3, anterior to piriformis. Piriformis connects the sacrum to the femur. Sciatic nerve then passes posteriorly out of the pelvis through the greater sciatic foramen. It most notably innervates the hamstrings muscles in the back of the thigh. The hamstrings provide knee flexion and hip extension. The sciatic nerve divides at the popliteal fossa into the tibial nerve, which innervates the back of the lower leg, and the peroneal nerve, which innervates the front and lateral aspect of the lower leg. The hamstrings muscles themselves are semimembranosus, semitendinosus, short-headed biceps femoris, and long-headed biceps femoris. Note that the peroneal division of the sciatic nerve innervates the short-headed biceps femoris. The tibial division innervates the other hamstrings muscles. Also note that the sciatic nerve may send fibers through piriformis. Piriformis entrapment's a commonly cited, albeit likely overblown, cause of sciatic neuropathy. Importantly, though, the sciatic nerve runs deep to the medial aspect of gluteus maximus. So when giving intramuscular injections, we should give them in the upper outer quadrant of the buttocks to avoid piercing the nerve. Finally, you'll hear the term sciatica for pain radiating down the back of the leg. Note that it's far more common that this is secondary to nerve root compression rather than true sciatic neuropathy. This concludes our diagram.